Hey, hi everybody. Welcome to Mental Health Recovery Blog with Bill MacPhee. I'm your host, Bill MacPhee, and I'm your recovery expert. And what I mean about recovery, my definition of recovery not only goes for people with a mental illness, but the general population as well. And recovery is when you wouldn't want to be anybody else but who you are today. Today we're going to talk about schizoaffective disorder, and in the previous videos we've talked about schizophrenia, and we talked about understanding your illness. And what this recovery blog is all about is the 6 pillars of recovery, our Bright Future program. And what we're talking about today is schizoaffective disease or disorder. Now, basically, what we should really understand with schizoaffective disorder is that mental illness, there's a fine line with mental illnesses as far as symptoms and the diagnosis and everything like that. Many people go throughout life with one diagnosis, and then many years later it will be changed to a different diagnosis. And the reason for that is because certain illnesses, there's a fine line between them and they kind of overlap. And that's what sort of schizoaffective disorder is like. It's an overlapping of disease. It's sort of schizophrenia plus a mood disorder, or say bipolar. So somebody with schizophrenia may hear voices, be paranoid, be delusional, but not have symptoms of a mood disorder such as mania or the high highs and the depression, the low lows. But then with schizoaffective disorder, people with schizophrenia may have certain symptoms of schizophrenia, but then they can also have depression or go into a manic state. And so that's kind of the idea of what schizoaffective is. It's a combination of schizophrenia and a mood disorder, and most likely bipolar in that. So that's a little bit about that. And you know what? Schizoaffective disorder is very hard to diagnose. It's tricky. That's why diagnosis has changed and everything like that. But it's still treated with antipsychotics and medications that are used for schizophrenia and also with bipolar. So that's what you need to know about schizoaffective disorder. And if you have a question on that, feel free to if you have any questions on this blog on what we're talking about. Doesn't necessarily have to be about the topic that I'm on each week, but it could be something in general, and I'll take the time to answer your question. And as well, what I want you to do is go to my website, billmacphee.ca, as well as our site, mentalwellnesstoday.com, and you can learn more, and you can sign up for our free newsletters and a lot of good things happening on those sites to help educate you and teach you about mental wellness. Once again, thanks for tuning in, and remember, there's always a way, and remember that there is life after mental illness, and remember that recovery is when you wouldn't want to be anyone else other than who you are today. Have a great day.